Now this was the notice from the National Medical Commission, and there are many things which, if you go through it, there are many things to which are there to be known, but not all are important. For as you are students, not that everything is important for you, everything. These are for the administration part as well. How to conduct the course, MBBS course. These are for the, this is for your institution, for your university, the guidelines to follow. But at least what I suggest is the syllabus for the different subjects, you go by that. So how many hours and everything, that is not for you, much for you to worry about. That is, who will worry about it? The universities and the institutions, whatever institution this is. So the Santiniketan Medical College and Hospital Authority, the academic section will worry about it, how according to the NMC guidelines hours we have to distribute the classes. These are for the, this is for the institution to worry about. What is for you? The syllabus proper. We'll come to this. This is not possible to discuss in one day. These are things, what are the areas, like you may have a general idea how that on any particular topic there are some must know areas which is expected of a student for that particular topic, a must know area that you have to know. Without knowing that, you are not, suppose not eligible to pass, because that is a very basic, but there are areas which are just more difficult than that. Okay, that part. So that is not expected of MBBS student, maybe that is not called a must know area. So these are classified, NMC is classifying those by various terms, by some abbreviations. So that is not possible and not really needed as well to discuss on the first day itself. So what you should concentrate on, leaving these pages, say up to page number 104, whenever you open this, up to page number 104 are most guidelines, not for the students to worry about, but for the institution who will guide you, who will make the routine for you, that how many hours for anatomy, how many hours for physiology, how many hours for biochemistry, and then so on from the second phase, the other subjects. But for you, what is important is these things. See, first column is, see this table, first column is number. Number means numbering of what? Of the competency. What is meant by competency here? Competency means, if we use it as a literal English term, what is it? After completing the course, the student has to be competent in about this thing. The knowledge has to be gained on this topic, and the student has to be competent about this thing. That is what is meant by this competency. So the student should be able to. So then the various topics are given and the competencies are numbered. For anatomy, you see the abbreviation is AN. So the first topic in anatomy is, if it is topic 1 anatomical terminology, so it is AN 1.1. I say it as 1 dot. So you may say it as 1 point, but what is the problem I am showing you if we call it point? So from the mathematical point of view, see, there is something called AN. It has been numbered AN 10 point, call it as point, 10 point. Point is mathematically decimal place. So 10.10. So 10.1 and 10.10 is same. Mathematically, it is same, right? So I prefer to call it not point, because point we may confuse with, it is not mathematical decimal. So 10.10 means after 10 the subclass is, that's, so that should be called 10.1 and 10.10 is different, but 10.1 and 10.10 is same mathematically. So to avoid confusion, I suggest you call it dot, 10.1, 10.10. Wherever it will end with the 9, it is okay. But after that, it will, that you may get confused. So AN 10.1 and 10.10 are different. So the first column heading is numbered, then competency, that means what the student is expected to be competent in, and then what I was calling, those are given in the 104 pages. What is K, what is S, what is K, what is KH, like this, these terms you will get acquainted with as we go on with the syllabus. If I try to explain this today only, then we will not find time to discuss today's topic. So I am giving you just a general idea. Just open this, tell your friends from the other batch. I will try to discuss it tomorrow also. But tell your friends from the other batch, just write CBME 2024 and you are just at the beginning of your course. Just get acquainted with these things. Okay. You see, it is possible on your smartphones. And these days, I think everybody of you has smartphones. Okay. So, competency, will come to this, what is KSAC, we shall get acquainted as we go on with the syllabus. Suggested teaching learning method is not actually your worry. Okay, how the teachers will, faculties will deal with it, that is and that is also suggested. So, sometimes we try to follow according, so we try to go by that. What is LGT, like what is the meaning of the term LGT? It is large group discussion. So, the NMC is expecting that that particular topic should be delivered through a large group discussion. Large group, LGT is for, I just can't recall T at this moment. Large group means that is we do it in the lecture classes when the whole batch is present. Some are demonstration classes, which is this class, which this session which is going on nigh on, and there are other terms also. Suggested assessment methods, again you don't have to worry. So, mostly you have to, what is your, just when beginning the course for the first, during getting acquainted for the first 10-15 days, what you should get acquainted with is the competencies, these topics. So, you will find so many topics in anatomy, physiology, biochemistry, you get acquainted with these topics. This is your, what are the topics given over, that is your syllabus. This is a professional course. So, you should just from your, using your basic, say, intelligence, understanding, you can understand when you are sitting for an university exam, you can't say this was not taught in my college or something like this. So, professional course you have to go by the syllabus which is given by the National Medical Commission, and you can't say, like I just gave one example on that day itself, like I think in biochemistry syllabus, there may be a chapter on how to vitamins, about vitamins. Now you already know it. There is not only 10-11 months. Every detail of every part of the syllabus may or may not be covered in the classes. So those topics which are new, we will try to cover most of the things, but one or two may get missed out, and which we particularly lay the importance on, which are new to you, like anatomy dissection classes will be done in detail. Everything will be, if we get the, sometimes what happens, the exam is preponed, sometimes it is postponed, sometimes due to some is an university exam in preponed. So don't expect that you will get whole 12 months. So effectively it comes to 10-11 months, 10 months of classes, and then last 1 month is preparation. How many exams you have to, internal exams you have to face at least 3. So the National Medical Commission has told at least 3. Okay, sorry, at least 2, but suggested is 3. So here we take 3 internal assessments. So 3 internal assessments are included, 3 internal assessments are included in these 9-10 months. Each internal assessment, say it will take 1 week or just more than 1 week. And the third one of the 3, that means the last one, which is usually is just before university exams for the first batch, say 1 month or 40 days before the university examinations. Okay, so that is the whole of the syllabus of the whole subjects, all the whole syllabus of all these subjects, anatomy, physiology and biochemistry, you have to face. And in the first and second internal assessments, the syllabus will be just whatever is done before the first internal assessment, you face in the first internal assessment. Whatever between the first and second, you face in the second internal assessment. But in the third internal assessment, which is like at the +2 level or at the secondary level, what we usually call as the test examination. Test. So the whole syllabus, there you face the whole syllabus. Okay. So it is similarly like here also. So you get it, the orientation of the syllabus and the examinations. Now here anatomy is like this, it is AN, and you just go through the competencies. As you go on with the syllabus, you will get acquainted. So there are so many, anatomy up to 12. So broad headings, broad topics are there, and in anatomy so many, up to I think more than 30. 38, more than 40. Okay, it is going on and on, you see. 70, okay. So anatomy syllabus is a vast one. Broad topic, topic 77, 78 up to 82, and there are subtopics. Okay, so this is the whole of the anatomy curriculum. So up to page, I think it will be from 105 to 147, 43 pages in this document, right? Physiology is not so, and anatomy, most of the hours in first phase is for anatomy, most of the hours. Like you can just calculate it from the routine itself. Your routine which you have made in this institution, that is 8 hours in the second half itself every week, 8 hours, 2 to 4 p.m. in the second half itself every week for anatomy. And in addition to that, there are lecture classes in the first half. I think 5 lecture classes for anatomy in the from 9 to 11 a.m. So how many classes will be there? 9 to 11 a.m. 6 days. So 12 hours. Out of that, 5 hours is anatomy. 5 or 6. 5. 4 is physiology, and 4 is probably biochemistry, and 1 is community medicine. 5 anatomy, 4 physiology, 4 biochemistry, 1 is community medicine. So 5, 4, 9, 4, 13, 1, 14. Yes, total 14. 12 in the first half, and on Wednesday second half there are 2 hours. 1 physiology lecture, 1 biochemistry lecture. So total this 14 hours of lecture every week. In case of if there is any holiday, then in that week it will be 1 or 2 hours, 3, 4 hours less. But on most days, like in the month of November, there is no holiday except Sundays. 6 days there is all are working days. Okay, so 14 hours. Out of those 14 hours, 5 for anatomy, 4 for physiology, 4 for biochemistry, 1 for community medicine. That is, you have to face community medicine university exam. You have to face in the third phase. Okay, in the second phase you have pathology, microbiology, and pharmacology, and in the last phase you have medicine, surgery, gynecology and obstetrics, pediatrics, ophthalmology, otorhinolaryngology. Ophthalmology is eye, otorhinolaryngology is simply called ENT, ear, nose, throat. So these subjects. So don't go by the number of subjects. That is first. What I tell the students is most difficult in that way is first phase, because a lot of time goes for the orientation itself. You try to orient yourself. So effectively what it becomes, practically first phase is very tough. So syllabus is very huge and you get only effectively 10 months, though it is structurally 12 months it should be. But suppose you are started the classes, foundation course was up to 22nd, you have started the subject proper classes on 24th. So it is not decided till now. It will be decided at a later stage, but you will see that by end of September you are having the facing the university exams like this. So it is structured as 12 months, but it is not 12 months. 12 months is including everything, even the results of the first phase university exams. So you are under the West Bengal University of Health Sciences. Okay. So all these medical colleges all over West Bengal are under the West Bengal University of Health Sciences, the office of which is situated in Salt Lake, Kolkata. It is in Salt Lake, Kolkata. How many are from Kolkata? Residing in Kolkata? Only 2 over here among the 23. So this is about physiology. Physiology, the naming of the competency is as PY. So how many were present in the lecture class on Saturday 9 to 10 a.m. physiology lecture session? You are present. Two of you joined on Monday itself. So see PY, Topic 1 is general physiology. We will be doing general physiology mostly on Saturdays. If there is any deviation, you will be informed. Saturdays 9 a.m. to 10 a.m. the general physiology lectures will be taken. PY 1.1 structure and functions of cell. This was the topic discussed. Cell structure, introductory class, cell structure. You don't remember? It was just last Saturday itself. So this is the first topic. We will in physiology we will go like this. General physiology. See, topic 1 is general physiology. Topic 2 is hematology. Topic 3 is nerve and muscle physiology, and then there are the subtopics. Topic 4 is GI physiology, gastrointestinal physiology. Topic 5 is cardiovascular physiology. Okay. Topic 6 is respiratory physiology. You don't have to write down anything. We'll just go by this. Topic 7 is renal physiology. Topic 8 is, I think, endocrine. Yes, it is endocrine physiology, including no, they have now separated. Earlier, I think it was endocrine and reproductive physiology under the same broad topic was written as same. But now it is topic 8 endocrine, topic 9 reproductive physiology, topic 10 is nervous system, central nervous system physiology. Topic 11 is special senses. Now, earlier it was special senses is actually a part of, if you think it as from the knowledge wise, it is included in central nervous system. Just for say convenience, they have divided as topic 11 is special senses, topic 12 is integrated physiology. In the 2018 CBME, the curriculum, it was special senses were included within central nervous system. Same topic. It is just they have numbered the topics separately, but the thing is almost same. So topic 12 is integrated physiology. So in anatomy you saw 80, in physiology there is 12, but just 80 and 12 it may seem that there is a lot of difference. His anatomy syllabus is a huge one. It is, but don't go by that only. Physiology syllabus is also, the volume is not that less. If you go by the numbers 80 and 12, you can't understand. So physiology, it will also take 8 to 9 months to complete the syllabus, the whole thing. So at first we are starting with, in the theory classes, these 4. You have 4 physiology sessions. So we will start with topic 1 general physiology, 1 day of the week. Topic 5 cardiovascular physiology, which has already been started yesterday. There is a physiology session on Monday 10 to 11 a.m. and Tuesday 9 to 10 a.m. So yesterday there was a class on cardiovascular physiology. Today there was another, and tomorrow there will be one. Wednesday 2 to 3 p.m. We will start with general physiology, mostly on Saturdays. This GI physiology, topic 4 will be started, and that will be mostly on Mondays. But yesterday it was CBS, but it will be mostly on Mondays. And topic 4 and 5, topic 2 and 5, cardiovascular and hematology will be on Tuesdays, Wednesdays. Okay, like this we will go on. After these are discussed, then the others will be covered. And this is structured according to the suitability of the students. So without having some knowledge on some things in general physiology, it will be difficult to enter other parts of this other systems. So except general, the others you may broadly call it as systemic physiology. So general, hematology, GI physiology and cardiovascular physiology, these we are to start with. We are starting with. So this is a briefly about your syllabus orientation, about the first phase, and how this is the physiology department, how we will start with physiology. After general physiology, we will pass on to nerve muscle physiology like this. So just again search CBME 2024, and in your initial days just get an idea about anatomy, physiology and biochemistry, your syllabus in your initial days. So some people will join, some students will join late, and it will not be possible to revise all these theory classes, but practical classes as we go on, we will revise together. So I think one session, one round of counseling is still left, one or two, one round of counseling is still left. Okay. So now you have been divided for this practical session. So one batch is going for one group. I mean, one group is going for anatomy, one group for biochemistry on each day, and one group for physiology. So, like you are group A, so you are having physiology on Tuesdays and Fridays, and on Mondays you are having biochemistry, anatomy. So Monday for group A, anatomy Mondays and Thursdays, anatomy, physiology group Tuesdays and Fridays, and biochemistry Wednesdays and Saturdays. This is 11 AM to 1 PM. Okay. So just tell your colleagues from the other groups also just to search CBME 24 and guide them. Whatever I told you today, I'll try to discuss with them also, but sometimes time gets short. Structure has been decided by the National Medical Commission. Now I'll just give you how we discuss over here the physiology practical session. So just write down if you want to. You will get acquainted as we go on, but you may write down that what are the broad headings. So we have to physiology practical sessions will include broad headings are hematology practical sessions, which will be mostly done in the laboratory. You have seen the laboratory. Those who are new may not have seen, but you had 1 or 2 hours on visiting the 3 departments. So the laboratory was over here, just outside this room, and after this room, the room beside this is the one clinical physiology room, and then there is the hematology laboratory. So the laboratory, physiology laboratory, which will be, so hematology sessions will be taking place. The venue of the hematology sessions is mostly over there. Some theoretical discussions we may have in this demonstration group. So that is one broad heading is hematology. Next is clinical and human physiology. And whatever topics we will discuss are there in this CBME curriculum. Say cardiovascular physiology. Cardiovascular physiology, the theoretical topics are there, and what topics to be discussed in these demonstration classes. So those are also mentioned in the CBME curriculum. But here in the physiology practical sessions, we do it like this: hematology sessions, the sessions on clinical and human physiology, and the sessions on amphibian physiology. Amphibian. So number 3 is amphibian. Amphibian, AMPHIBIAN. Amphibian means what does that mean? Who live both in water and land. So we'll come to that. We don't have any for you for the MBBS curriculum. We don't have the experimental setup, that is not required. How we'll discuss it when we discuss amphibian physiology. For now, you just write down. It is one of the. These are the broad topics which we'll go by this, the sessions on hematology. So on one day we will not be having both sessions on both hematology and say clinical. So either it will be a hematology session 11 AM to 1 PM or clinical physiology session. Amphibian physiology, whatever is there for you, will take I think maybe 2 weeks in total. That is very brief. And you have out of, I did not tell the discuss the marks division. You have 200 marks for theoretical examination and 100 marks for practical examination. So you may write down that also first. I just forgot. I usually discuss it in the first class. 200 total 300 for each subject in the first phase. Anatomy 300 marks and pass marks is 150. Physiology 300 marks, pass marks is 150. If you get 149, it is fail. You have to sit for that subject once again. For university exam, you have to sit. You don't clear if you get 149. Biochemistry again 300 and pass marks is 150. Now earlier it was, even few years ago it was like this. You have to pass 50% separately in theory and practical. From 2023 onwards they have changed it. So I'll give it to you. So 300, 150, it is same, 50%. Earlier what it was, you have to get 100. So you out of 200 in theory you have to get 100. So 99 was fail. So now what they have made it is, you have to, it is not 50% separately in theory and practical. Understand it very well. It is 40%. For theory, out of 200, if you get 80, it is enough to pass the theoretical part. In the result sheet, it will be mentioned like this: theoretical marks out of 200. So there will be a column, and theory you have 2 papers in each discipline. First paper 100 marks, second paper 100 marks. So adding these two out of 200, earlier it was you have to get 100, that means 50% separately in theory, 50% separately in practical, and obviously if someone gets 50% in out of 200, 100 and 50% out of 100, 50 in practical, out of 300 it will automatically be 150 or more, right? But now they have changed it. What are they saying? They 200, if you get 80, it is enough to pass in the theoretical part. Out of 100, if you get 40 in practical, it is enough to pass. Okay. But just think, if you get 80 and 40 and pass in theory and practical, but you are not passing in aggregate, because 80 and 40 comes to 120 out of 300. So I don't know whether it is good or bad, but if you target 80 in theory and 40 in practical, that you will not be able to pass that subject. So if the situation is, if you get just 80 in theory, then you have to get 70 in the practical portion to make it up and get 150. If you get, say, 40 in practical, so for that to be made up, you have to get at least 110 out of 200 in theory. Then only it will become 150. So 40% separately in theory and practical eligibility, but as in the whole, it is the eligibility is, as a whole aggregate eligibility is 50%. So you have to make it 150. So better to think it as I will have to get 50% minimum. Minimum is 50%. If you get 100 in theory and 50 in practical, you are passing. So if you think like this, 80 is enough, 40 is enough, actually it is not enough, because 120 is not enough, it has to be 150. But earlier what it was, theory and practical cannot be compensated by each other. That can be compensated now, but if you are short in one, you have to get excess in the other. So that is what is the situation right now for the last 3 years or so. Okay, so now, but even if you get, say, 100, just hypothetically 100 out of 100 in practical portion, but 79 in theory, then it is fail, right? You get this? Minimum for theory is 80. So even if you get 100 in practical and 79 in theory, and aggregate is coming to 179, but it is fail, right? Say if you get 200 out of 200 in theory, if some student obtains, this is hypothetical, nobody will get, but 200 out of 200, and you get 39 in practical, then the aggregate is coming to 239, but it is fail. So minimum 80 out of 200, minimum 40 out of 100, and minimum 150 out of 300. Now this is the orientation. Again, it is better to have it in your mind from the initial days, right? So it can be compensated by each other, but not below a minimum marks. That is 80 and 80 for theoretical part and 40 for the practical part. I am talking about the first phase. I exactly don't know about the second phase onwards. So you can consult with the academic academic section, but I'll suggest leave it for now. When you pass the first phase, then think about the other phases. So first phase, 3 subjects are like this. Okay. Now why this came to my mind when I was trying to tell you, amphibian is it will take 2 weeks, and here we keep it as this is upon the institution. So this is a short part of the syllabus is amphibian physiology, and out of 100 marks in the practical examination, just 5 is there for amphibian. But it is a scoring part. Scoring means it is, if you just go through that short syllabus, even if you answer well, then even 5 out of 5 is possible. So you will have to face theoretical examinations, 2 papers. Last few years it is going on 2 papers on 2 separate days. So suppose you sit for Monday anatomy paper 1, usually on Tuesday it will be anatomy paper 2. Some years ago it was like this, same paper first half and second half, same subjects 2 papers in the first half and second half of the same day. Now last for the 5 years we are seeing that it is, the university exam routine is such that 3 subjects in the first phase, 6 papers, 6 days exam, theoretical. So 100 marks on one day, each day 100 marks you are facing, and practical examination 1 day, 100 marks MBBS first phase, practical examination 1 day. I think not only first phase, all the these 14, 3, 3, 6 to 8, 6, 14 subjects, practical examination, whatever marks allotment is there, 1 day exam. Okay, practical and viva, practical and viva. So in case of anatomy, physiology, biochemistry, it is practical viva 100 marks. Viva is on the, viva means the oral examination, you have to answer from the theoretical part 40 marks, and 60 marks is for the physiology practical or anatomy practical, biochemistry practical, 60 marks. Out of the 60 for physiology, amphibian physiology, we are keeping it here as 5 marks. But those 5 are scoring marks. It is, even students answering well are getting even 5 out of 5, at least 4 out of 5 like this. So amphibian physiology is 5 marks. Hematology is still, some years it is 10, some years it is 15. Rest is clinical and human physiology, and one part you have objective structured examination. It is, in short, it is called as OSPE. In the clinical subjects, physiology, anatomy, biochemistry are called preclinical subjects in the curriculum. Pathology, microbiology and pharmacology and forensic, these are called paraclinical subjects, and the rest are medicine, surgery, these are clinical subjects. So in the preclinical subjects, you are having this thing is called objective structured examination, is called OSPE, objective structured practical examination. In the clinical part, same thing, almost similar things are named as OSCE, objective structured clinical examination, OSCE. So OSPE will be facing 15 marks, hematology 15 marks. These details I will give you later on. For just now, you concentrate on the first day, just get oriented that 100, this exam structure 200 marks, 100 marks for theory, 200 for theory, 100 for practical. Minimum pass marks in theory is 80, minimum in practical is 40, but minimum for passing in aggregate is 150. And in physiology, amphibian physiology, 2 weeks it is 5 marks, rest is hematology 15 to 20 marks, and rest is clinical and human physiology. Now this compound microscope, the topic which was discussed, is in a way a part of this hematology syllabus for the practical. By microscope, you will work with the microscope in anatomy also, and you have worked with it as you have entered this MBBS course. You have worked with it in biology and physics and all, you have worked with the microscope, but we had an introductory class on microscope, and here now the microscopes which we are dealing with over here all are electron, at least most are compound electron microscopes. So when you enter the hematology lab, you will get acquainted with this. So just I will give you the topics on the first day. So hematology, the topics which are mentioned in the NMC curriculum. So the first you write down differential leukocyte count. This is the topic. So I am just making you write it down, just you will have it in your own notebook. What are the topics you have to deal with in the exam? Differential leukocyte count. Leukocyte means WBC, white blood cell. Then it is, before that you may write down one topic, we will deal with it separately, although it is a part of the DLC itself. In the syllabus it is mentioned as DLC, but before that you have to learn differential. We will explain these terms. So when you study this topic, these terms will be explained. Differential leukocyte. Leukocyte means WBC, white blood cell. Differential leukocyte count. And before that, you give it as hematology topic number 2, you give it as You write number 1 as preparation. Number 1 you write it preparation and staining of a peripheral blood smear. Staining of a peripheral blood smear. Blood smear, SMEAR, smear. Then differential leukocyte count. Third you write as estimation of hemoglobin. Fourth you write as determination of blood groups. Okay, you have written. Fifth is estimation of bleeding time and clotting time. Bleeding time and clotting time. Clotting time is called also maybe called as coagulation time. For now you write it as clotting time. You have heard about blood coagulation? Coagulation and clotting is the same thing. Bleeding time and clotting time. So how many? 1, 2, 3, 4, 5. Sixth is total erythrocyte count. Or you may write total count of RBCs. Erythrocyte and RBC is same. Total erythrocyte count. And seventh is total leukocyte count. That is total count of WBCs. So you will learn these in the hematology lab, and for 15 to 20 marks in hematology practical, this out of 60 marks. So 40 is for Viva out of 100 on the day of the practical and Viva. 40 is Viva out of 60. 15 to 20 on these hematology topics. 15 for objective structured practical examination. That will be these objective structured examination is on the whole syllabus. Okay. Clinical will be 40 marks. 5 on amphibian, and the rest you have for hematology notebooks. How you have to prepare the hematology notebooks will tell you just after a few days. We'll start with the syllabus now. So these are the topics on hematology. In clinical and human physiology, you just write down the systems for now. There are several topics. So these are the topics for hematology. Okay. So for clinical and human physiology, you have. So first you write number 1, criteria of physical examination, or criteria for physical examination. Clinical, this physiology deals with how to clinically examine subjects. When you go to the wards from the second phase onwards, they will be patients. We will discuss what is the difference between subject and a patient. When an individual should be called a subject, when an individual, a human being, should be called a patient. So you know about criteria for clinical physiology or clinical and human physiology. Earlier you used to have a separate session, that means a separate part in the exam for human physiology. Now we do it together. That's why so criteria for physical examination. Then number 2 is general physical examination. Okay. Number 3 is clinical examination of the cardiovascular system. 4th is clinical examination of the respiratory system. Don't write the same words every time, just you remember it as clinical cardiovascular system, then respiratory system. No need to write the same words. Cardiovascular, after that respiratory, yes. No, not same. Obviously, cardiovascular and respiratory systems are different. So, respiratory clinical examination of the GI system, but with an oblique you write abdomen. Now, why I mention abdomen is that clinical examination of the GI system, gastrointestinal system, and you write abdomen. Abdomen, if you simply call it in a layman's language, it is the belly. Okay, so gastrointestinal system includes, why I just mention the term abdomen, because don't confuse it. We can't clinically from outside, just by clinical we can't examine the internal organs, the intestine, stomach, and all these things. So it is the clinical examination. It should be called the clinical examination of the abdomen, but in the syllabus it is written as GI system. So GI system will examine over the abdomen. That is so clinical examination of GI system oblique abdomen. Okay, and clinical examination of the nervous system. That is the 6th one. So in the nervous system there are some. It is better if you know there are some subtopics. So just write them down. Just to from the first day itself, you have an orientation with what topics we have to deal with. In nervous system, you will separately deal with. So write as, maybe you write as 6A, 6A, small a, or 6 small Roman 1, like this. That is one subtopic of the nervous system. First is examination of higher functions. 6B, higher functions, higher functions. Just you write down the words now, no need to understand now. Just you have an orientation of the syllabus from the first day itself. That's why I am making it right. Otherwise, you will come to know of everything as we go on with the syllabus. So 6B is examination of the sensory system, SENSORY. Written 6C, that means under nervous system, the third one, examination of the motor system, examination of the cranial nerves. Motors in the bracket, okay, examination of the cranial nerves, write down examination of the cranial nerves. How many pairs of cranial nerves are there? 12 pairs, 12 pairs. So how many cranial nerves are there? So 24. So whenever the question is how many cranial nerves are there, answer 12 pairs. By mistake, by casually, what we answer is 12. The number is 24 and 12 pairs. How many pairs of spinal nerves? 31 pairs, right. So cranial nerves, 12 pairs. 12 pairs, okay, examination of the cranial nerves. In the 6C, examination of the motor system, in bracket you write including reflexes. So sometimes reflexes is mentioned as a separate heading, but it is, remember, it is under the motor system. And as we discuss the syllabus, you will understand that reflexes is a part of the motor system. The word motor means related to muscles. So reflexes is a part of the motor system. So clinical examination of motor system including reflexes. Why we mention these are separate topics? You see clinical examination of the cardiovascular, respiratory, gastrointestinal system. These will take, each of these topics will take 1 or 2 classes, 1 or 2 sessions, like these 2-hour sessions, 1 or 2 sessions. But in this nervous system, each of these subtopics will take a considerable amount of time. So we mention this separately. Otherwise, topics are, all these topics you have to do in. So itself, cranial nerves, examination of the cranial nerves, 12 pairs of cranial nerves will take, say, 3 or 4 weeks, almost like a month. Examination of the motor system, at least including reflexes, 2 or 3 sessions. Okay, 2 or 3 weeks means cranial nerves is a, it will take time to discuss. It is, say, 12 pairs of cranial nerves, at least whatever is there in the there to discuss, it will take, say, 5-6 sessions at least. 5-6 session means 3 weeks. So each session you have, each week you have physiology 2 sessions. Okay, for each student, whatever group you are in, you will get 2 sessions on physiology. So 6 session means 3 weeks. So that's why these are say time consuming topics, and we mention them separately. Now see, this is the just as we go on with the syllabus, you will be better acquainted, but this is the overall structure, how you are to face the exam, the subjects in the first year, the marks division and all. So today's topic which we will be discussing and is examination of the arterial pulse, which is a part of the arterial pulse. So which is a, in the clinical examination part, the examination of the arterial pulse comes under general physical examination as well as clinical examination of the cardiovascular system. Okay, so examination of the arterial pulse. Now what is arterial pulse? What is your idea about what is the arterial pulse? What is pulse? Arterial pulse, we simply call it pulse. Sometimes casually we refer to his examination of radial pulse. Why? Because just you may, this is why, because mostly the arterial pulse is estimated at the radial artery. So sometimes even we the faculties just speak it out like this, it is examination of the radial. Actually, it should be called examination of the arterial pulse, because this pulse may be examined at other sides of the body as well, other arteries as well, and it should be actually. So it should be called examination of the arterial pulse, and in the books you will be finding the heading examination of the arterial pulse. But usually, most commonly, you have seen when you yourself have gone to a doctor's clinic as patients. Okay, so you have seen commonly it is measured at the radial artery in the hand, okay, at the wrist joint, but it is actually examination of the arterial pulse. So what idea do you have about the pulse? So what is the pulse? So cardiovascular system in theoretical classes has just started, and there was the introductory class on cardiac action potential yesterday and on ECG today. So we'll not go into the details of the theoretical aspects of pulse, which we'll have to study and will be discussed, but just a general idea, what is pulse? What do you think? Is it blood flow? Is the pulse, it is related to blood flow, but it is the blood flow itself? Is it? No. So what is it? Anything, you just speak out your mind. Demonstration classes, these small group classes is for interacting. See, large group classes are usually, it will be a one-way lecture class. There are less chances of interacting. So the students will sit and listen, and the faculty, the teacher will deliver the talk. But in small group classes are for interacting as well. So you have a basic idea what is this pulse, you have heard. So what is this pulse? Is it blood flow? It is no. So what idea do you have? Okay, when somebody is asked, then please let her answer. It is not actually the blood flow. Yes, it is related to it. So yes. Oh, actually, it is not the rate of blood flow as well. It is not the rate. Yes, it is expressed in beats per minute, right? Yes. What is your idea? In a way, you can tell it the rhythm, but what it actually, okay, sit. Okay, what is calling the rhythm? Because the pulse is like we feel the pulse like a wave. Now just think it in your head, it is like a wave. So how is this wave produced? It is produced by the heart is beating, the pumping action of the heart, and from the heart, what is the function of the heart? The heart is pumping oxygenated blood to most of the body, and it is also sending deoxygenated blood to the lungs for reoxygenation. This is what the heart does. You have entered the MBBS course, so this basic idea you should be having. The heart is pumping oxygenated blood to the body, and which part of the heart does it? Oxygenated blood is pumped from the left ventricle through the great vessels, which is the aorta. So pulse, to examine the pulse is required. What is required? It's palpation is required by feeling. So what is the method? We'll have to practice. What is the method for examining the radial pulse? Pulse can be examined at various sites as we go on with the syllabus. In the theoretical classes will be discussed. There are various sites. So but most commonly which is examined, you learn at very first, that is examining the pulse at the radial artery. So where is the radial artery situated? So I think in anatomy we will start with the superior extremity. Usually it is superior extremity or maybe the inferior extremity. Radial artery is in the superior extremity. What is the superior extremity? Superior extremity means in layman's term you call it the hand, but in medical term it is the upper limb. Upper limb consists of the arm, the forearm, and whatever is in layman's term, in Bengali, hath. Hand. Hand means this whole upper limb, we call it hand in the layman's term, but in medically, the part between the shoulder and the elbow is the arm, the part between the elbow and the wrist is the forearm, and the part between the forearm and the wrist, distal to the forearm, which includes the fingers, is the hand, not palm, hand. So examination of the arterial pulse is by palpation, and the pulmonary arterial pulsation, that cannot be, that the pulsation, the waveform in the pulmonary arterial tree cannot be felt. Okay. So usually most commonly the pulse in the clinical setups is measured, or we should not call it measured, we should call it, the term should be estimated or determined at the radial artery. So radial artery is situated in the superior extremity. In anatomy syllabus, you will either start with superior extremity or inferior extremity, usually with the superior extremity, sometimes inferior extremity. So radial artery is one of the arteries in the superior extremity. Where it is situated? It is situated, so radial artery, it is situated, it should not be called like that, situated. The part of the radial artery which is used for determining the pulse, that part is at the wrist joint. So you see there, everybody feel your own wrist. So in the lateral part, so have you been acquainted with the terms lateral and medial? Some of you joined just yesterday. So lateral means there is something called the anatomical position. Anatomical position you have learnt about. Anatomical position. So what is the anatomical position? Like this. If you stand, if somebody stands, this is like anatomical position. So lateral, medial are relative terms. One part of the body is medial to another part, and lateral and medial and relative terms. Most simply speaking, whatever is towards the midline is medial, whatever is away from the midline is lateral. So in the lateral aspect of the superior, by meaning lateral aspect of superior extremity, in this anatomical position, away from the midline, if we, so which is more away, this inner, this part of the hand which is in the anatomical position towards the body, or away from the body, which is away from. So in anatomical position, which is the most lateral finger? The thumb, and the small finger is the most medial one. Small finger, no, little finger is the most medial one, and in between are the other three. So whenever you use the terms lateral and medial, you should speak like this. What are thumb is the most lateral in terms of fingers. If you say if you speak about the middle finger is medial to the thumb and the index finger, but it is lateral to the little finger and the ring finger, right? Like this we get acquainted with the terms medial and lateral. So see, in laterally there is one prominence. In the most lateral part at the wrist joint, there is one prominence. This prominence is called the styloid process, right? When you learn in anatomy, we learn about the superior extremity. This is called the styloid process. So feel the styloid process, and which part of the radial artery is to be felt during examination of the arterial pulse, that part is situated just medial to the styloid process. Now the procedure is to feel this pulse. So some terms will be new. These terms, as we go on with clinical physiology, we will get acquainted with and will feel very familiar. But at the beginning, these terms will be new. So first, to feel these very well, what you have to do, semi-flex at the knee joint, wrist joint, semi-flex at the wrist joint. So do you understand the term flexion? So flexion means, flexion at a joint means, you will get acquainted with these terms in the anatomy class. Flexion at a joint means the joint is composed of, there will be a proximal part of a joint and a proximal means, again proximal means, what is proximal? Towards the midline or the heart, proximal. Distal means away from. So say if we speak of the elbow joint, what is proximal? The arm is proximal to the elbow joint, but the forearm is distal to the elbow joint. So in a layman's term, the upper extremity is called the hand. This is the hand. In Bengali it is hath. But in medical terms, you have to, hand is the part distal to the wrist joint. Between the wrist joint and the elbow joint is the forearm, and between the elbow joint and the shoulder joint is the arm. So what are the two limbs which is contributing to the elbow joint? This is the arm and the forearm. These are the two parts of the upper limb. So flexion is bringing these two parts which are contributing to the joint closer to each other. So in case of the wrist joint, flexion means bringing the hand and the arm closer to each other. So this is the flexion of the. So to feel the radial, this waveform at the radial artery properly, it should be semi-flex. That means not full flexion. This is full flexion of the elbow joint, what I am showing right now. And if you do it up to this is like semi-flexion, say half flexion, semi-flexion. Likewise, semi-flexion of the wrist joint is like this, semi-flexion of the wrist joint, and the wrist joint is to be wrist joint of the individual, so that the clinician can feel it properly, feel that waveform properly. The wrist joint of the individual is to be semi-flexed. Just write these terms, although it is given in books. Write semi-flexion and semi-pronation. ACMI, give a hyphen and write flexion. What is required? Semi-flexion and semi-pronation at the wrist joint. Semi-flexion and semi-pronation, P-R-O-N-A-T-I-O-N. Just to write the term I am explaining. Prone, P-R-O-N-A-T-I-O-N. There will be two terms, right? Okay, you have written these terms. Just again make a bracket and write two terms. Prone, P-R-O-N-E, comma supine, S-U-P-I-N-E. Supine position is like lying on the bed, how we usually lie on the bed. That is our back resting on the bed and the front, that is the dorsal aspect of the body. The back is the dorsal aspect of the body. The front is the ventral aspect of the human body. So ventral aspect facing upwards, say towards the ceiling of a room. If we lie on a bed in a room, so towards the ceiling of the room. Ventral aspect, if you lie say on the grass, whatever is facing the sky, that is the ventral aspect of the body, the part of the body. So lying, supine means lying on the back. In layman's terms, it is lying on the back. And just opposite is prone, P-R-O-N-E. That is lying on the ventral aspect and the back facing upwards, the dorsal aspect facing upwards. Okay, this is the meaning of the terms supine and prone. Now, semi-pronation means, see, in the anatomical position, if you consider a person lying down instead of standing, this is supine position. So, prone position of the superior extremity is just overturning it, and if you just do it like half, it is semi-prone. That is what the meaning of the term semi-pronation. So, semi-flexion at the wrist joint, semi-flexion and semi-pronation is what is required to feel the radial artery pulsation waveform properly. If the person is very lean and thin, then maybe even without doing these maneuvers, semi-flexion and semi-pronation, you can just feel it. But it is better to do it. Some persons are obese from over the skin and the subcutaneous tissue. It is difficult to feel. So, if you semi-flex and semi-pronate it by feeling the styloid process first, and then you ask the person, feel the styloid process. Styloid process will be prominent. Even if the person is obese, styloid process is the bony prominence. So, it will be found out very easily. But inside, just medial to the styloid process is the radial artery present. Most common. Anatomical locations vary. Okay. Like there are deviations, so much deviations. Someone's heart may be located on the right side of the chest. That is called dextrocardia. The term is called dextrocardia. You will learn it later. Dextrocardia. So, but barring exceptions, usually the radial artery pulsation waveform is most prominently found out medially to the styloid process, and even in obese subjects, obese individuals, by semi-flexing and semi-pronating the at the wrist joint. That is between the, just at the junction of the hand and the forearm. So, the process is, just one of you come forward, just volunteer, take this chair, sit down. So, whenever we, sit, we will learn about the criteria of the physical examination. We mentioned it, how to make the subject comfortable and all. So, if this is my subject, if this is the clinician subject, we will have to make him comfortable. First, we have to make the subject comfortable. We'll discuss about, there will be separate class on this. So we'll just ask him to cooperate, feel his styloid process, and then ask him. See, when you are examining a layman who is not a medical person, he or she does not understand what is semi-pronation, semi-flexion, what is flexion, what is pronation is not expected. So you have to show it yourself to him or her. They do this thing. So you have to say, you cannot just simply say, just think it in your head. You cannot just simply say flex your hand. So he or she will not understand what is flexion, what is pronation. So you do like this and do like, you have to show it. And otherwise, if the subject still can follow, you have to tell, just cooperate with me, I will do it for you. Okay, and you do it. You just semi-flex and semi-pronate. If it is like this, semi-flex and semi-pronate, and you just go medial to the styloid process, and with one or two of your fingers, just try to understand whether you can feel the pulse. Like right now, I am feeling his. Okay. So in 90 out of 100, in say 95 out of 100 times, you will feel like that. This is the most easiest way to access the radial pulse from the outside. Radial pulse means the waveform at the radial artery. So we feel it. First we feel it, and then we keep 3 fingers on it. So to measure the estimate the pulse, we have to use 3 fingers. Which is the 3 fingers? Okay, you go over there. So this is how to locate and feel. Okay. Now how to feel it? We have to feel it. We use 3 fingers. Which 3 fingers? The index finger, the middle finger, and the ring finger. These 3 fingers are placed. Conventionally, these 3 fingers are placed proximally to distally. Proximally means, again, proximal will be according to the subject's body. So if we place like this, so towards the subject's heart will be the clinician's index finger, then middle finger, and most distally is the ring finger, and we will feel the pulse. So first thing which we have to learn, or which we have to, is to count the pulse for this waveform. This waveform is now hitting the fingers, and we have to count this waveform. It is going up and down like this. This is, we have to count it for 1 minute. So that counting and expressing it is what we are determining by counting is the rate of the pulse. So we do it. So there is nothing actually to teach here. You just put the fingers and then start counting. Preferably the atmosphere should be a conducive one. It should be, that means no one is disturbing you. You are just counting the pulse. We learn about the criteria of the examination. Like for, if a male clinician examines a female subject, there has to be a female assistant. A female assistant means a female who will be there. This is just for comfort. We will discuss these things. If the female clinician is examining a male one, there should be some of the same gender as that of the subject. So in this setup in the clinic, whether it is in clinic or in a hospital, in a ward, wherever, so we are doing the clinical examination, this has to be followed. Now we are counting in case of pulse, we are counting the rate. This is how to count the rate. So you just look at your watch. So nowadays there are so many devices. You can use the stopwatch of a mobile phone. So usually it is written in the books, use a watch. So having a watch, from the exam point of view, remember mobile phones are not allowed in the examination hall. So a watch, it is preferable that you keep a watch by yourself, because if you have to determine the pulse, you need a watch. Okay. So the seconds hand of a watch, or if there is some stopwatch pattern, if it is available, because you have to count it for 1 minute. We express the rate is expressed in beats per minute. So say you count, say 80. So you have to express the rate of the pulse as 80 beats per minute. What is the normal pulse rate? We have to learn about it. So that is what is the very common answer till now. Just you have entered the MBBS course. So on the first day 72 is acceptable, because since our school days we have heard this number 72 and it is just ingrained in our head. But nothing, almost nothing in medical science can be an absolute number. It is always a range. So remember it from the first day. It is always a range. So 72 is what is generally we learn. Say we have learned in standard 3 of our school days. But it is actually a rate, and it is actually a range. And normal is considered as, if the beats, number of beats are 60, it is considered normal. If the number of beats are 100, again it is considered normal. 60 to 100 beats per minute is normal. Below 60, there is a term called bradycardia. Above 100, there is a term called tachycardia. So we learn about these terms. But whenever from now on you are asked what is the normal pulse rate, don't utter 72. It is 60 to 100. Now, at the same time as we are counting, this will come by practice, we are counting, we are also feeling this waveform. So sometimes it will be, in case of diseases, why we are learning in the first year, and in the first year of medical school, clinical examination is done. Usually our colleagues, our own friends, our own colleagues will be your subject. When you are examining, your friend will be your subject. When he or she is examining, you will be the subject, and we will learn about the whatever is going on normally in the human body, normal things. So you will find that there are usually, if we are not diseased, okay, there will be, the beats will be very regular. One beat will come after another. Okay, these will be regular. But sometimes there may be 3 beats are there, 1 beat is not there. So a time will elapse before the next 3 beats come. So that is a irregularity. So that is what is, to noting this irregularity or regularity is what we call what he told us, the pulse is itself a rhythm. Pulse is itself not a rhythm. Pulse is, what we mean by the pulse is the waveform, but there is a definite rhythm of the waveform. This is called the rhythm of the pulse. Noting the rhythm of the pulse means noting whether it is regular or it is irregular. We get 3 beats and then a time elapses before another 3 beats come. So this is irregularity in the rhythm. So the rhythm will either be regular, which we will find in most healthy subjects, or it may be irregular. So rhythm is either regular or irregular. Okay. Now irregular rhythm can also be of 2 types itself. What we just mentioned, 3 beats, then you get an idea about one particular beat is there for how much time, one particular beat for how much time, 1 beat is absent, then another 3 beats, then 1 beat is absent, another 3 beats. This is an example of irregularity, of course, but there is a pattern in the irregularity. You get it? 3 beats, 1 beat absent, 3 beats, 1 beat absent, 3 beats, 1 beat absent. Now sometimes it may be like in, say, complete heart block. When the heart is not being able to complete heart block, we learn about the complete heart block in the theoretical classes. There may be, sometimes you may get the pulse waveform is like this. There are 5 beats, then 2 beats are absent. Again there are 2 beats, 1 beat is absent. Again there are 3 beats, 2 are absent. Again there are 4, 2 are absent. So this happens. This may be sometimes you may feel by holding the pulse at this wrist joint, by feeling the radial pulse at this wrist joint. So irregularity, of course this is irregularity, plus there is no pattern. If 3, 1, 3, 1, this is a definite pattern. But if it is out of any kind of pattern, that is also irregularity, out of pattern. So these are named as, the first one is regularly irregular. That means there is a pattern. It is irregular. It is not fully regular as in healthy subjects, but it is, irregularity has a pattern, that is regularly irregular. And if the irregularity lacks any kind of pattern, that is irregularly irregular. Like from tomorrow onwards, if she thinks, don't take it personally, if she thinks I will come from Monday to Saturday but will be absent on I'll come from Monday to Friday, but will be absent on every Saturday. And if she continues like this for 6 months, that pattern is irregularity, but regularly irregular. But if she thinks I'll come on Mondays and Tuesdays of this week, next week I'll come on Wednesdays, Thursdays, next week I'll come on Thursday, Fridays and Saturdays for the class. So there is no, this is of course irregular, but and there is no specific pattern of this irregularity. That is irregularly irregular. So it can be felt at the groin. So femoral artery. So we can, femoral artery is a branch of, as far as I remember, I have studied anatomy 20 years ago, but it is a branch of, I think, from the abdominal aorta. Just can't recall right now. So in anatomy you will read it, femoral artery. So pulse can be felt as at various peripheral arteries, the radial artery being the most commonly used for clinical settings. And radial artery in the superior extremity, just near to the radial artery is the Arlan artery in the medial part of the hand. So at least in the first year you have to learn about rate, rhythm, volume, basically that means from the examination point of view, you have to, when you are asked to examine the pulse and report it to the examiner, this examiner means the person who is conducting your exam, report it to the examiner, then you have to speak at least about rate, rhythm, volume, but there are few other points also. One of them is delay and equality. Now there is a slight difference in these two terms. Equality means rate, rhythm, volume. Say you measure in one, you just determine in one radial artery. Say you are a right-handed person, as a clinician, we are right-handed. Some of us may be left-handed also. So you use your right hand. So right hand you determine one radial artery, a radial artery pulsation, rate, rhythm, volume. Another radial artery, and you just note the findings whether more or less equal on both sides. So that is what is meant by equality. And delay means you have to, if you have to determine delay, you have to examine both radial arteries simultaneously. So your two hands has to be used simultaneously, and just you can get it right over there, you can get whether there is the difference, whether one hand the pulsation is, say there is an obstruction of the blood flow in the left hand. Left hand means left upper extremity somewhere. So one waveform will reach earlier than the other, whether if the obstruction in one extremity, so there will be one waveform will reach earlier than the other. There will be in that hand or in that upper extremity, you should not use the term hand is the layman's term. In that upper extremity, the waveform will reach later and there is a delay. So you can note that only when you examine the two radial arteries at the same time simultaneously. Or there is another example, the clinician has two hands only, not 10 hands like Ma Durga. So two hands, so it is possible to compare the delay in two parts, one radial artery and one femoral artery together. Say the right radial artery and the right femoral artery. So if there is an obstruction somewhere in the abdominal part of the aorta, so it is expected that femoral arterial pulsation will be somewhat delayed than the radial artery pulsation. So you examine the right radial artery with one of your hands, 3 fingers with one of your hands, and the femoral artery with the 3 fingers with another of your hands. So rate, rhythm, volume, delay and equality, at least you have to report rate, rhythm, volume, and until and unless told you have to measure. This is in most areas of clinical examination, you have to do it in both hands until and unless told by the examiner who is conducting your exam. Okay, you don't need to proceed further, I have seen what you can do. You have to examine it in both hands. So you do report. So that is rate, rhythm, volume. You do it in both hands and you add the terms delay and equality. For delay, you have to examine both hands simultaneously. For equality, you can do right hand first, left hand first, then, or left hand first, right hand then, and then report the rate, rhythm and volume. Okay. And there is just one more term, that is condition of the arterial wall. You don't need to write, this is given in books. condition of the arterial wall, CONDITION, condition of the arterial wall, that is not a part of the pulse determination itself, but the arterial wall, sometimes the arterial wall, like in old age, it gets thickened. Okay, it is not a condition of the arterial wall, is not a determination of the waveform itself. It is, but along with determining the pulse, we determine the condition of the arterial wall. How? For that, we have counted the pulse, we have noted the rate, rhythm, volume. Say you have noted the rate, rhythm, delay and equality also. Just keeping those hands, you have to press with them. Up till now, blood was flowing and you are determining the waveform. You are just getting an idea about the waveform. Now, you just press with the distal finger and the proximal finger and stop the blood flow. Sometimes there is some backflow from the distal part towards the proximal part. So, preventing those flow. Now, in the middle part where your middle finger is lying, in that part there is no blood flow at that particular moment. You have just pressed with your right hand, because here there are small arteries. By pressing, the blood flow will get obliterated for few seconds, and you just roll your middle finger in that semi-flex position. The position is the same. Roll your middle finger over the radial artery, and you do this from your this first year itself. Over in healthy subjects, you learn this is how a radial artery, how this peripheral artery feels. Now, after learning this in the first phase, when you go to the wards, in aged patients or aged subjects, you will see that the artery wall has thickened and you can feel it with your middle finger. This middle finger, by obliterating the blood flow, you are not feeling the pulse or the waveform now. And this is not a finding of the pulse itself. What we do is, along with finding the pulse, we just note how the artery feels like, because a thickened artery may be an indication that obstruction is setting in. Why the artery is thickened? Because of deposition and cholesterol and these things inside the, so that may be an indication that obstruction is setting in. So this is important to note, and you note it by obliterating the blood flow and rolling the middle finger over that artery. So if you don't learn how a normal artery in a healthy subject feels like, you can't compare it with a thickened artery. That's why we learn it along with the noting the pulse from the first year itself. So this is about how to examine the pulse. Now we will have more classes on it, and we will practice it, and you practice it among yourselves also from today. You have learned, share what we have learned about the examination, this pattern and the syllabus with your friends. Searching CBME 2024 on the internet, on the search engine, most commonly it is used is Google. Share it with your other friends. Till now there is no class representative, no one has been elected. In 1 or 2 months it will be elected, and communications with the from the faculties to the students will be made through the class representatives. Okay, so share this with your friends. For the other batches, we will have this class for batch B and C, for batch C tomorrow and for batch B on Thursday. And what I may mention today is, you have to follow one, at least you should follow one physiology practical textbook, one theoretical textbook and one practical. For physiology practical syllabus, one textbook. So what I most commonly suggest for beginners is the book by Dr. A.K. Jain. You may follow any book. Okay, this is just recommendation. There is no hard and fast rule. But for the beginners, this is it is simplified. What I think, this is my opinion. Opinions of different faculties may vary also. But the book by Dr. A.K. Jain will be good for the beginners, and very good book is the book by Dr. C.L. Ghai. Right, these are the two, but I recommend for the first stages, you follow the book by Dr. A.K. Jain, and the book by Dr. C.L. Ghai you can follow it later. You don't need to buy 2, 3, 4, 5 books, and it is not possible. I will suggest the book by Dr. A.K. Jain, but actually you can follow any book. The aim is to learn the subject, and from the examination point of view, produce in the exam, pass the exam, and to learn the subject. In my opinion, the book by Dr. A.K. Jain is good for the beginners. The language is lucid, it is colorful. That's why I suggest it. Any book you can follow. There is a book by Dr. Pramanik, Dr. Devashish Pramanik. Okay, there are other books, Dr. Pal. There are many books. So, Indian authors are now huge in number, but this is a time-tested book. So, I suggest that one. You may read any book, but whatever topic is being discussed, read the book. And in case of clinical examinations, you have to practice it among yourselves also. Okay, it is preferable in the first year of medical school. You leave. So, medical school it is preferable, and NMC or the medical counseling is saying that medical education is residential. Okay, but practically many don't live in hostels and all, but it is, if you live in a hostel, it will be good for you only, because academic discussions are needed. So this topic, theoretical aspects of this topic will have to be discussed. So there will be another class on this particular topic only, but you have the preliminary idea, start practicing it.